Hey everyone, welcome back to Corporate Decoder, the place where we try to make sense of corporate filings. Today we're diving into Selectis Health's 10K. It's a healthcare company, but will this filing be healthy for our understanding, or will it require a shot of strong coffee? Let's find out. This report gives us a look at Selectis Health's performance over the past year, including their financial situation, risks, and future strategies. In short, it's a deep dive into everything that makes the company tick or potentially tock. First, some background. Selectis Health owns and operates assisted living, independent living, and skilled nursing facilities. They used to just lease these facilities out, but since 2019, they've been shifting towards directly operating them. Think of it like moving from being a landlord to a hands-on business owner. In September 2021, they rebranded from Global Healthcare REIT to Selectis Health to better reflect this new strategy. Let's get into their strategy. They are based on 4 principles: quality care, opportunistic investing, portfolio diversification, and conservative financing. This tells us they focus on quality service to attract and retain residents, look for good investments, and manage risk by spreading their investments across different types of facilities and locations. Of course, it's impossible to ignore the impact of COVID-19. The company had to navigate a changing landscape of federal and state regulations, from mandatory staff vaccinations to restrictions on visits and admissions. These requirements added complexity and cost to their operations. Let's jump over to the financials, which is what we're really here for. One big change we notice is that rental revenue has gone down from 634,574 to 322. However, the company's healthcare revenues went up a bit. So maybe not all bad. Digging deeper into healthcare revenue, we can see it's increased from $34.5 million to $39.1 million. This, the company says, is due to better Medicaid rates at their facilities in Georgia and Oklahoma. Medicaid rates are based at TDs in Georgia and Oklahoma. Medicaid rates are basically the price the government pays them to provide healthcare to people. Medicaid is crucial to these facilities. However, the company reports their healthcare grant revenue went down, mainly because of the end of healthcare grant revenues received from the state of Oklahoma. So while they are receiving more money for services overall, the free money is not flowing as freely. Next, let's quickly take a look at the expense report. Their property taxes, insurance, and other operating expenses decreased a bit, about 3%, saving the company about $1 million. The decrease is attributed to a decrease in operational headcount, resulting in lower wages and lower COVID-related expenses. General and administrative costs also decreased. So the company has been trimming off excess headcount in 2024 to save money. Their provision for credit losses also decreased. This means they're setting aside less money to cover potential unpaid bills from customers. They say their depreciation went down because a lot of their assets became fully depreciated. Plus, they sold assets during the sale of the Goodwill Hunting property, so some assets were depreciated as a result. The company did record a $2.1 million gain from selling an asset, which is definitely good news for their books for the year. However, the amount they spent on interest stayed mostly the same. The company says they've reduced their costs by repaying their mortgage from selling the Archway property. Also, income from employee retention credits went to zero, as this was COVID aid that the company no longer receives. So what does all of this mean? When we get to the bottom line, we can see that even though expenses are down and certain income went up, they still have a pretty significant net loss. They reduced their loss from the previous year from nearly $4 million to about $2.4 million to about $2.44 million. It might seem like bad news, but it means the company has been doing a good job and continues to improve every year. The company is improving and hopefully they continue this trajectory. Let's take a peek into how the company might pay for things. The company has a sizable amount of debt. There are senior secured promissory notes, fixed and variable rate mortgage loans, lines of credit, and other debts. The senior secured promissory notes, which are basically promises to pay back borrowed money, carry an interest rate of 11%. They tried to refinance and push back the due date for the debt to make it easier for them to pay it back later. The company also entered 2 commercial lines of credit with Southern Bank for a total of $1.5 million. They are borrowing money, so they're going to have to pay it back later. Looking at the cash flows from the past year, the company used about $1.8 million in operating activities, which is where money is used for their day-to-day stuff. This is a decrease compared to last year. So even though it's negative, it's still improved greatly year over year. They say the reason it's negative is that they need money to pay debt. They made almost $2.5 million in investing, mostly from that sale of a building that we mentioned earlier. It can be a very good source of income. Then after investing, the money gets used in financing. It's where the big money moves are made. Now let's move on and quickly summarize key accounting policies, which helps us understand how they come up with these numbers. They talked about how they handle situations where their properties might lose value and how they estimate the revenue they are entitled to from patients and third-party payers. This is how they estimate when people don't pay and it goes bad for them. The report also mentions that the board of directors is paid in cash. Each director has various fees that they earn as a result of their work with the company. The company also mentions that they have equity compensation plans available with 300,000 shares of common stock allocated to it, but no one has been granted to it yet. Now, what about the risks? Every company has them, and it's good for them to mention them so that potential investors and users are aware of risks. A number of risks the company mentions are related to the effect of the pandemic on occupancy and revenue, especially within facilities. Another thing they mentioned had to do with limitations in property acquisitions and dispositions related to access to capital and credit ratings. To make sure everything is above board and transparent, the company mentions that every single one of their officers, directors, and big shareholders have been filing the right paperwork on time. Finally, there's cybersecurity, because every company needs to take this seriously. Their cybersecurity efforts include oversight from their board, collaborative approach, and technical safeguards such as firewalls and intrusion protection systems. They even hire third-party service providers to give an outside opinion and check on their security. Thankfully, the company mentions that all of their cybersecurity efforts have been reasonably successful to date, eyeing the debt